everyone, this is Don and I welcome you back to another episode of the Subcontinent. Since now I'll be taking a long leave, I would like you to meet our new host, Mr. Mehdi Gulzadeh.
Thank you, John. Well, as he said, I'm Mehdi Gulzadeh. From now on, I'll be doing the rest of the episodes. Our episodes aim to address important issues in the subcontinent which affect the governments, people, organizations, and the region as a whole. We will try to explain the issues, break down controversies surrounding them, and try to have some external perspectives from experts and people.
Please stay with us.
In this edition of the Subcontinent, we are going to take a look at the deadly surge of the second wave of the COVID pandemic in India. Then we will explore how the Indian government has managed the catastrophe so far and its plans to stop the spread across the subcontinent.
Before we delve into our main story on the coronavirus pandemic in India, let's talk about another tragedy that has been plaguing the globe: Takfiri terrorism.
A car bomb was detonated across a school in the neighborhood of Dasht-el-Barchi, and when students rushed out in panic, 2 more bombs exploded. The neighborhood is home to a large community of Shias from the Hazara ethnic minority, which has been often targeted by the extremists. More than 80 people were killed and about 150 more injured in the Saturday attack.
Teenage girls in Afghanistan are torn between fears and ambitions. Fear from the rising Takfiri presence in their country and ambitions of education and freedom. Being a schoolgirl in Afghanistan was already difficult, as they had to study in tattered tents or the open air, and the schools were desperately overcrowded without essential facilities such as toilets. But the hardships and threats they face outside school may change or even end their lives forever.
Indians are suffering from a devastating wave of pandemic like no country has ever experienced. Yes, it is true that the size of the population of the country makes it an arduous task to contain an epidemic of this magnitude, but the government's negligence about this second wave is taking a heavy toll on the people. My co-host Mehdi will walk you through some of the frightening figures.
The recent rise in the number of COVID cases has registered a peak in almost all the charts by the relevant authorities. India has recorded over 23 million cases of COVID, while the death toll is about 250,000. The weekly number of infections has averaged a record of over 390,000, while the country's daily coronavirus cases rose by 330,000, accounting for 1 in every 3 deaths reported worldwide each day.
The deadly surge in India's COVID cases has overwhelmed the subcontinent, and it may even grow to a global disaster. This second wave of the pandemic is larger and spreading more rapidly than the last one, and is also affecting more people across age groups, including children and infants. Since the start of April, daily infections have been soaring. People are gasping to stay alive as they wait for critical care beds and treatment. In addition to families, the increasing rise in infections has placed an enormous strain on health and critical care facilities. Hospitals cannot handle the load, and families are scrambled for scarce medicines and oxygen cylinders or a doctor's appointment. In many cities, mass funeral pyres and cremations never stop in the parking lots that have been turned into crematoriums to accommodate the rising number of the dead. Dozens of bodies wash up on the banks of rivers every day, while the locals complain about the authorities' inaction to control the unbearable smell.
it is not hidden the fact that it's pretty out of control, especially last week. Now it looks a little bit under control this week and past 2 days. So if I analyze why it went out, probably there are multiple factors. One factor is related with the people, means people were a little bit complacent. They got vaccination, including healthcare worker. We thought that, okay, everybody was tired of masks. Everybody is tired of, not having, you can say, to get together with each other. So a human is a social person, isn't it? They try to find out the way to meet each other. So they started meeting. They thought that pandemic and now this virus is not going to come again. And even if come and we are vaccinated, especially high risk population got vaccinated. So one is that complacency from the people side. Second, there were election rallies. There were farmer rallies. So probably people also got a message that even at the highest level, probably this is not going to come. Thirdly, of course, it looks like some complacency from other like government agencies, and so nobody expected.
The World Health Organization has said that the variant of the COVID-19 behind the acceleration of India's explosive outbreak has been found in dozens of countries, not only in the subcontinent, but all over the world. According to the UN Health Agency, the B1617 variant had been detected in more than 4,500 samples uploaded to an open access database from 44 countries in all 6 regions of WHO. Pakistan, Bangladesh and Nepal are India's neighbors worst hit by the double mutant, while the UK had reported the largest number of COVID cases caused by the variant.
Lancet Medical Journal has said Modi's government should be held responsible for presiding over a self-inflicted national catastrophe. According to an estimate by the Institute for Health Metrics and Evaluation, that is an independent global health research center of the University of Washington, the deaths could potentially reach a staggering 1 million by August this year.
In the early days of 2021, India seemed to be on the path to normalcy when the daily positive cases were reported less than 10,000, the lowest in about 8 to 10 months. Vaccinations had started and hospitalization had decreased. India then started to open up and ease restrictions while the virus was evolving and mutating. Many research centers and organizations had predicted the second wave, but they did not know about the severity and when it would hit the country. But the government decided to ignore that. The Indian government's handling of the pandemic has created public uproar, while many in the world have pinned the blame on Prime Minister Modi for the new wave because he had ignored many warnings about the looming catastrophe. In early March, a forum of scientific advisors set up by the Modi administration had issued stern warnings of a new and more contagious variant taking hold in the country. This was after a parliamentary committee had warned of a shortage of oxygen in the coming months. Despite the warnings, the federal government did not seek to impose major restrictions to contain the spread of the virus. Some critics say arrogance, hypernationalism and bureaucratic incompetence have combined to create a crisis of epic proportions as the government allowed religious gatherings and political rallies regardless of the facts. Millions of people, largely unmasked, attended election rallies for the 2021 Assembly election that were held by Modi, leaders of the ruling Bharatiya Janata Party and opposition politicians. The other super-spreader event was Kumbh Mela, a major pilgrimage and festival in Hinduism.
Millions of devotees took part in the gathering without any form of social distancing. The pilgrims then went back to their home states and catapulted the contagion.
This wave is different from the previous wave, and it is the not only infectiousness but the severity of infection is very high. So we are able to grasp the use of steroid in particular window that has helped us in decreasing the oxygen requirement in the patients. So everybody has learned over past 2 weeks, including governments, including public, and including physicians and clinicians. And also, people have started vaccinating themselves, and probably it may not help in this way, but of course, we may be able to revert the third wave, which somebody projected that may come.
India is the world's biggest producer of COVID vaccines, but shortages of the shots in some states have hindered the opening of inoculations for all adults. Some people say the shortage is because India exported about 60 million doses to 70 countries, but some experts believe the problem goes deeper. India produces over 2.5 million doses of vaccines every day. Even if it manages to vaccinate more than 2 million people per day, the nationwide vaccination will take over 2 years. Moreover, dozens of countries are sending large shipments of oxygen products to India, but the virus-hit country lacks the necessary means to distribute them to the people in need. Adding to the misery, there are also reports of deaths in people who had received both doses of their vaccines. The Indian double mutant may need new or moderated vaccine formulas.
If we look at the real-time experience of past 1 month, what I can say with some surety that those people who were vaccinated by Covishield actually didn't land up in major severe pneumonia. Now, when we talk about this is a very generalized statement. It has to have a lot of exceptions. Now, look at the look at the other vaccines like Pfizer and Moderna. They also had 5,800 infections. They had, means though there were not much mutation, but without mutation, there were so many breakthrough infections. So it's very hard to say that those vaccines can prevent mutation more effectively than Covishield. One, it's a time will tell. Second, at times the studies which are done in at a vitro level, at a vivo level, in a very small group of people, the studies being done, they were done when we didn't had so much mutation. So if you look at the efficacy of Moderna and Pfizer as compared to newer vaccine like Novavax and Johnson & Johnson, leave aside Covishield, these efficiencies of 90-95% were there when we had original Wuhan strain. Now they have not been time tested with these type of triple mutation, double mutation, and which evases immunity. So one is not very sure, but since we haven't seen them, actually they haven't tested, so we feel that okay, they may work because we are humans. We always feel that there is some hope. So I think we need more studies, and if this type of infection unfortunately strikes the places where people have been fully vaccinated by Pfizer and Moderna, then we'll come to know actual ground situation.
India spends only about 3% of its GDP on healthcare. The country is in serious need of infrastructure. The third wave of the pandemic is coming while the Indian variants have been spreading to the neighboring countries. If not contained, the Indian pandemic may be able to further deepen the global plague.
Now to have more insight, we are joined by Tina Thacker, Assistant Editor of The Economic Times. Now Tina, why did the pandemic get out of hand in India?
So right now we are seeing a massive lethal wave of COVID virus in the country. We have variants which are circulating in India, but the variants are alone could not be blamed for the dramatic surge in cases and deaths seen in India. The country appeared to have let its guard down with huge social mixing and large gatherings. India felt that the crisis was over, dropping mask wearing and other protection measures. but the virus was quietly spreading. So here we are. We have seen, big election rallies happening, and we have also seen religious, this festival where we saw huge gatherings, and this has all led to this situation, I would say.
How is the government handling the situation, and what grade do you give the Modi government?
That's a really sad part that we are not just seeing COVID cases, but people have been dying due to inadequate supplies of oxygen, medicines, something which is as basic as a hospital bed. People are not getting hospital beds. So the health infrastructure is actually crumbling, which is a really sad part and shows the sad state of affairs. Instead of government, Twitter has become the new helpline where strangers are helping each other, getting medicines, getting beds. I think government is doing its bit, but probably that's not enough, and the situation has got out of hands.
What can it do to reduce the severity of the disaster? Basically, what can we hope for?
So we have inoculated just about less than 2% of the population right now. And given the size of the country, it's a Herculean task. Then there is a shortage of vaccines. We don't have enough supplies. We have only 2 companies which are supplying vaccines to the country. Though we expect more companies to get approval in days to come, we can hope for maybe importing vaccines from other countries, like for instance US, which is not using the AstraZeneca vaccine. The supplies can be diverted to India. Then we have J&J, where people are hesitant to take J&J, the Johnson & Johnson vaccine. So that's the only silver lining that we see right now to get enough people getting vaccinated.
Who are the most hit in India, and what can be done for them?
We have to keep just keep updating with the testing. We are not testing enough. We don't know if the testing has reached to the rural areas. So, and this time around, what we have seen is that the virus has impacted more young people, which is also in the productive age group, getting impacted because of the virus. So we have to at least ensure that the basic medical care is provided to them, at least to the people.
Tina, we'll give you a break so we can see media and cyberspace.
Viruses mutate all the time, producing different versions or variants of themselves. Most of these mutations are significant, and some may even make the virus less dangerous, but others can make it more contagious and harder to vaccinate against. This variant, officially known as B1617, was first detected in India in October. Researchers in India are now trying to pinpoint what is behind the unprecedented surge, which could be due to an unfortunate confluence of factors, including the emergence of particularly infectious variants, a rise in unrestricted social interactions, and low vaccine coverage. Untangling the causes could be helpful to governments trying to suppress or prevent similar surges around the world. India's laboratories are struggling to keep up with the punishing COVID-19 surge as its scientists try to track and understand new coronavirus mutations. The World Health Organization has classified a variant first identified in India, known as B1617, as a variant of concern, saying preliminary studies suggested it may be more contagious than other variants. The WHO scientists didn't report any evidence that vaccines aren't effective against the new variant. India is in the process of ramping up its capacity to do genomic sequencing to track changes in the virus's genetic makeup by examining positive test samples. While experts suggest that the mortality rate in the second wave is similar to last year's wave, data shared by the Indian government clearly shows that the ratio of young adults in the 30 to 40 age group dying of the disease is higher than the first wave. This means there are more young children losing their parents, and some have been left totally alone as their entire immediate family has succumbed to the virus.
Tina, thank you for the wait. And now India's neighbors are already reporting cases of the Indian version. How long does it take for the wave to spread throughout the globe, and what happens then?
So the variants have arisen in various parts of the world, including the British variant, which is the UK variant, which first entered in India, and we still have it. Now we have variants traveling abroad from India. We have South African variant, which has traveled to some places. So everybody has to keep a watch out for them. The main protection against them is only two things: prevent spreading by masking and by avoiding super spreading events. And second is to just ramp up vaccination so that people don't get seriously ill. That's what we can do right now.
Now, Tina, considering the large size and population of the country, is nationwide vaccination even possible? What is a feasible scenario? How long does it take, and how much vaccines are needed?
Yeah. So, India is a vast country, but definitely it is possible. It will take a long time because, we have shortage of vaccines. So ideally, if you have plenty of vaccines available, you could go down to people as young as 18 years. But now that India has announced that they're going to vaccinate people who are above 18 plus, it's going to take some time because there are not enough vaccine supplies. So we have to just make sure that we have to protect our 45 plus population, because they are the ones who are most vulnerable, and maybe look at younger people with comorbidities. But we have to just use that rationing and triaging as long as we have got limited supplies of vaccines.
And one last question: how can the international community help the situation?
As of now, we are getting a lot of foreign aid. A lot of countries have helped India in getting oxygen concentrators, medicines. So we have a lot of foreign aid coming in to India, which has really helped. India has been leading a push from lower and middle income countries at the World Trade Organization to do away patents on vaccines. So we'll have to see how other countries react to the same, faced with this possibility of losing out on their profit margins and monopoly. We are hopeful now that the US has supported it. So we may see this coming, which would mean not immediately, but maybe in the long run, we'll see more vaccines coming in, and it will be cheaper as well. So that's the silver lining that I see now.
Tina, thank you for your precious time, and we'd love to have you back on the program again. Now let's see how the people have reacted on social media and the cyberspace.
This account, named When the Flame Turns Blue, believes the Indian pandemic is now a global concern. Rojana Punjab has appreciated the Indian Navy's efforts to bring the much-needed oxygen tanks from abroad. Akanksha Sharma has reflected concerns by an Indian blogger about the country's mismanagement of the pandemic before he succumbed to the disease. Niyati Bava has tweeted about an indigenous drug that may help in oxygen regulation in COVID patients.
Alright, so that was our episode covering the second wave of the COVID pandemic in India. This was also my last episode as the host of this show, and I must say it has been an honor serving you for all this time. My colleague Mehdi now will carry the torch in our upcoming programs. On to Mehdi.
Thank you, John. To watch bits and pieces of our episode and more updates on the subcontinent, follow us on social media platforms and make sure to give us feedback. We will meet again the same time, same day next week.
Thanks for watching.